Good afternoon, and thank you all for joining us this afternoon to celebrate the 11th Annual Sisters of St. Joseph of Sault Ste. Marie Awards for Excellence for St. Joseph's Continuing Care Centre here at the South Bay Road site. This is an award given by peers in recognition of their colleagues. In my opinion, this is the most prestigious award that one can receive. As a result of the ongoing pandemic, today's events do look a little different from previous years in that there's only a handful of us here to celebrate with you. However, it is being videotaped and will be uploaded to the website for all of your colleagues and family members to view. The Award of Excellence is very important and prestigious in that it carries on the mission and values of the Sisters of St. Joseph of Sault Ste. Marie, who began the tradition of healthcare in our Sudbury community. The Awards of Excellence recognize those individuals who demonstrate outstanding actions that reflect excellence and caring and service to others throughout the organization and who do so by going beyond the call of duty. This tribute has been awarded since 1992 at the St. Joseph's Health Centre, during which time many deserving individuals have been recognized, and you now are amongst those individuals. We are delighted that we are carrying on this wonderful tradition here today at St. Joseph's Continuing Care Centre, and we feel that those honored today are certainly very deserving. This award, given annually, is celebrated with all our staff who strive to make our organization unique with its caring environment. And please know that when we review the names, they are anonymous, and so we go solely on what the nomination forms have contained within. The committee, which is comprised each year of a past recipient, the sisters, members of our Mission and Spiritual Religious Care Committee, and myself, after much discussion, are confidently able to select individuals who are honoring today. So at this time, I would actually also like to acknowledge those who were nominated but did not receive the award, because I think that that is certainly very honorable and prestigious in itself as well. So those individuals are Lori Sentis, Michelle Dumont, Lindsay Hawes, Nancy Johnstone, Pierre Paymal, and Lorinda Points. So it is now my honor to introduce the individuals who are recognized as the brightest rock stars by their peers during this COVID pandemic year. And I will now introduce them one at a time. So the first individual was nominated by Pulkit Singh and Maxine Prue, and that individual is Allison Antonio, who is one of our rehab assistants. Congratulations. Do you want to give the award, Karen, please? So unfortunately, you have to stand here, and Maxine is going to come up and read the nomination form for us, please.
Thank you.
You wanting us to please? Good. No, you have to stand up here, Alice. Just to make it more embarrassing.
Don't make me by myself.
You're doing great.
Okay, so in my opinion, Allison is one of the brightest staff here during this pandemic. She maintained her professionalism and remained calm throughout the ups and downs of the pandemic here at CCC. Allison always made sure that all of her needs of her patients were met and always left room for her peers. Allison always was a huge positive experience or presence on our floor. She was always willing to help out staff, including nurses, and filling PPEs, serving breakfast, and reassuring and comforting her patients as well as her peers. Allison always is ongoing, making sure that we are maintaining safe protocols here at CCC, maintaining infection control. And I have a little bit of a story to share, actually. Could you imagine we were scrubbing goggles with a toothbrush at one point? And I remember Allison saying, "I better get an award for this." There you go. Here you have it, Allison. Well deserved. And this is from Pulkit Singh. I believe Allison went above and beyond to ensure each patient received their rehab while maintaining all isolation measurements. She always did let a hand during the, she never let down the quality of rehab for her patients in 2 North, despite the ongoing difficulty of maintaining isolation guidelines. She definitely made it work with all her patients, again with PPEs and bringing all the equipment, exercise equipment into patients' rooms rather than bringing them into the gym. So I believe Allison is very deserving of this award and continues to work extremely hard every single day. She also helps in order to maintain the highest level of service to our patients, and I'm very proud of Allison for setting high standards for everyone here at CCC. Thank you, Allison.
Thank
Do you want to say anything, Allison?
Yeah, sure. I wrote a little something.
Oh, here, I'll hang on to your award.
Sure, thank you. First, thanks to Max and Pulkit. It feels really good to be nominated by other very hard and dedicated staff here at CCC. I feel humbled to receive this award because there are so many people during this pandemic that could receive this award as well. I was reflecting back on the many false positives that we had here and remembering the fear of like the anxiety and the rush and everybody's questions. And I remember that time I just said, okay, right now, if I can be anything, I'm just going to be kind because that's what I can bring right now. So I worked hard every day to come in and build up my team. And I remember chatting with some staff members and just saying, guys, I spend more time with you than I do with my own family. We got to make the best of this right now. And like Max said, I spent a lot of my year last year scrubbing goggles, filling PPEs, serving breakfast, and right now I'm the One South hairstylist just because they can't get to a hairdresser, so I've taken that upon myself. It was easy to come to work every day when you love what you do and you work with an amazing team of people, so that made working through this pandemic a lot easier. I've been lucky enough to work with the 2 North team and Heather and the 1 South team and Vicky. And honestly, CCC has like some of the best caring professional healthcare professionals I've ever worked with. So although this award says my name on it, I feel like it belongs to all the staff who showed up. The parents that left their kids at home to come in to care for others, parents who dropped their kids off at daycare, people who came in regardless of how they were feeling themselves throughout the pandemic. So I'm very humble and very thankful for this award, but I feel like it goes to so many more people. So thank you.
Okay, that was awesome, and I agree that it is true that every single person who's working here is a rock star. This has been a very challenging year, and Allison, thanks for sharing those words. But again, congratulations. It's now my pleasure to announce the second recipient. She was nominated by 2 anonymous individuals, and so Carrie Gervais, our VP of Clinical Services, will read her nomination. But the next recipient is Linda Mass, our RN, who has been here since we opened. So congratulations, Linda.
Congratulations. Thank you. Pause for a picture. There we go. It's me.
It's you.
Miss McHugh.
Oh, you're good.
Okay. I would like to recognize Linda Mass, clinical leader on first floor, as one of the shining stars at SJCCC. Linda is a compassionate and dynamic nurse who is dedicated to clinical and service excellence. She has the ability to build working relationships and earn the trust with staff, patients, and family members. Linda has the confidence to inspire and drive change in practice. She is open to new ideas and ways to do things in order to improve patient outcomes. Linda has a strong attention to detail and is committed to quality improvement. She has an interest in professional development and is always willing and available to support staff to learn more. Linda is open and honest and respects all members of the team, and she is determined to provide the highest level of care by using best practices at all times and leading by example. In these busy COVID-19 pandemic times, the amount of work that clinical leaders like Linda face can be overwhelming. Regardless of the amount of pressure she is under, Linda comes to work every day ready to give 100% to her patients, her team, and CCC. So that was the first anonymous one. This is fun. I don't usually get to read at these. Linda Mass, clinical leader, is one of the biggest rock stars on our team. As clinical leader on the first floor, I'm sure her days fly by. She was always busy facilitating patient discharges, working with patients, families, physicians, and staff to keep the unit running smoothly and ensure the needs of her patients are being met. Although the pandemic has been difficult on all of us, Linda has made it a little less stressful by being on top of providing us with reminders on wearing our PPE, keeping informed of the changing directives on how to manage COVID-19, keeping patients and families informed, and continuing to follow the values of the organization. She has enriched the quality of life of our patients by continuing to stay focused on the rehab goals and keeping the team motivated to help the patient, achieve those goals. COVID-19 makes it really easy to forget why we do what we do. Linda offers a constant reminder that we need to keep moving forward for the sake of our patients and for their loved ones. If not, they will not be able to go back home.
Congratulations. One up here if you do.
Sure. I too agree very much with what Alison had said about, I don't think this is just for me, it's for everybody on our team. Both first and second floors, we mix it up, and it's been a challenging year for everybody, that's for sure. But I think it goes without saying with our lack of COVID patients, just how well we've done with our protocols and everything from having newly hired clinical externs to our reliable staff, environmental staff, our physicians, of course, our lab, everybody. It just speaks to the good work that we do as a team. And whoever nominated, thank you very much.
Way to go, Linda.
So, thank you.
That's awesome. Okay, and we have a third recipient this year, this individual was nominated by Kelly Fleming, and Kelly is here to come up and read the nomination. And the third recipient, which is very rare, is we have a physician this year who is Dr. Mike Aniel. So congratulations, Dr. Aniel.
He took the long way.
Sorry?
Said he took the long way around. Congratulations.
Well, thank you.
You have to pose for a picture.
Do I a big smile?
Yeah. We can see it in your eyes.
You can, I was going to say. Perfect. Thank you.
Congratulations.
And you can stand a little closer, Mike, by the sign. There we go. Thank you, sir.
When I came here, I just wanted one thing. I wanted to go first. So,
So
so I didn't have a chance to get all nervous, but here I am, going last. Okay, so I've nominated Dr. Mike Aniel for the Sisters of St. Joseph Award for Excellence, as I believe he encompasses this facility's values of integrity, dignity, excellence, and service. Integrity. I have worked with Dr. Aniel for approximately 4 years. I'm not going to lie. When I first met Dr. Aniel, I was a little intimidated. He would come in on Friday mornings looking rather serious, and I felt he would rather be anywhere else. During our first few rounds together, there was not a lot of conversation outside of patients' concerns and subsequent orders. The more I worked with Dr. Aniel, however, the more I realized my first impression couldn't be more from the truth. Dr. Aniel is one of the most kind, caring, compassionate, and thorough doctors I have ever met. He treats everyone around him, including myself, with respect. Dignity. While working through our patient concerns, Dr. Aniel always makes me feel like the information I am providing is relevant, and he works through interventions with me, providing education as he goes along. I was a relatively new nurse when I started working with him, and with his guidance, I have acquired knowledge and confidence in my patient assessments. I feel myself and Dr. Aniel share a vested interest in our patients, and this creates positive outcomes for them. Excellence. Dr. Aniel also has excellent bedside manner, and his patients adore him. The patients quickly realize that their concerns are being acknowledged, and he goes above and beyond to investigate problems that may have been overlooked prior to the admission here. Because of this level of care, there have been many patients who have asked Dr. Aniel if he can be their family doctor when they are discharged. During admission physicals, Dr. Aniel always pulls up a chair and sits at the patient's level while he is gathering health information. He has held patients' hands while providing bad news and celebrated with patients when they are being successfully discharged home. Service. On the day he rounds, Dr. Aniel dedicates the whole day to this facility. Because of this, he never makes me feel I have to rush through rounds because he needs to be somewhere else. I know I can contact Dr. Aniel regarding a patient, even if it is outside of regular on-call hours or when he is on vacation. I do not abuse this privilege, but if I have to call him about a complicated patient, he never makes me feel like I'm bothering him. Dr. Aniel recognizes that patient care is multidisciplinary and makes himself available to speak with other team members of the team if they have questions about patients. He will also meet or call with patients' family members to address their concerns. Dr. Aniel is active in discharge planning and has attended rounds with Dr. Clark in the past, which was very beneficial. When Dr. Aniel is on the floor, he is always willing to assess another doctor's patient if they are having an acute issue. He also covers vacation for his colleagues and provides the same level of care to all the patients. During the pandemic, Dr. Aniel was and continues to be active preventing the spread of COVID in this facility and in his practice. I think most of the staff in this facility are aware that his PPE is a priority to him. He also takes patient symptoms very seriously and will not hesitate to isolate patients out of an abundance of caution. I want to take this opportunity to let SJCCC and the board members know the positive impact Dr. Aniel has had on the patients he has taken care of in this facility, as well as myself. Dr. Aniel is well deserving of the Sisters of St. Joseph Award for Excellence.
Thanks, Kelly. Awesome, thank you so much. And we actually have a few special words today. Our Chief of Staff, Dr. Christine Clendenning, couldn't be here today, but she asked that Carrie please come up and just say a words in recognition of this awesome award that you're getting. Yeah, so Carrie, if you want to go ahead there.
Sure.
Being on the spot.
Just a little bit. Dear Mike, wish I could have been there in person today. I cannot think of a more deserving individual. You are an outstanding physician. Your kindness and compassion with your patients and your respectful, collegial relationships with everyone you cross paths with make you a highly regarded team member. Enjoy your moment. You deserve it.
Thank you.
Awesome.
Well, I didn't prepare anything formal, but I do have a few words, maybe a reflection. Thank you to Kelly very much for nominating me. You know, you walk into the building every day and you see the pictures on the wall and you think, wow, what a great job they must be doing. And I never thought that, you know, you get a sense that, you know, within you know, involving the staff and the facility, and that maybe the physician would never necessarily end up being recognized in that way. Those are certainly the nicest words anybody's probably said about me in the last 30 years since I've been doing this. I remember when Kelly and I first met, it was actually doing rounds on the first floor. And afterwards, Kelly says that she's going to accept the position up on the second floor as a clinical lead, but she said, but I'm only going to do it if you promise to stay. So I certainly made that promise, and I guess it's been 4 years. I was wondering whether it was 4 years or 5 years. It's kind of like a marriage, eh? It feels like 100 years. But thank you very much, and obviously for those kind words, and thank you to the board and the people on the committee who recognized that. I thank you very much. It's easy to do a good job if you enjoy coming in, obviously, to work, and you don't wake up in the morning at 6 o'clock in the morning, roll your eyes, and try to smother yourself with a pillow and get back to work. And when you come into an environment that you enjoy coming into, it does make it much easier. But it's also important to obviously, as Allison was saying, is to recognize the staff. I'm certainly honored, very honored with this, and humbled at the same time, particularly during the past, I guess, year, almost going on a year and a half, during a pandemic when everybody's really been working the hardest that they can possibly work to make patient care the best that it can possibly be. And we're lucky that we have a smaller facility where everybody can really, and you can notice this. It's difficult to do this job if you don't have the right people to work with, obviously, as Allison and as Linda were saying. I think working with individuals, the right individuals, elevates you so that you work harder and strive harder just to do a much better job. And when you have the interaction with physiotherapy and occupational therapy and the nurses and the social workers and everybody involved, and you take the time to talk to them on your rounds, and you really do get to learn and understand much better what patient care really is. And 30 years ago when I first started, and we were rushing in and rushing out, and we're going to 3 different hospitals, and you really didn't get that understanding of what the patients really needed. So here you do get that sense, and only because everybody is working really hard to make sure that patients do get the best care that they can possibly get. So I guess it's easier to do my job given those circumstances. And of course I would have to give a real thank you to Kelly, because without Kelly, I probably would not be able to elevate myself to the same level that I have in previous years. She is just simply indispensable as far as I'm concerned, and thank you very much. And it's been a pleasure working with you, and we will continue to work together. I don't know if I have much more to say, except thank you very much, and I will cherish this, and hopefully stick around for a while yet and postpone any retirement plans. Thank you very much.
So thank you, Dr. Aniel. So again, congratulations to our recipients. So congratulations to Linda, to Allison, to Dr. Aniel. Again, certainly all very well deserved, as we now know from the nomination forms. Not that we didn't know that before, but you can see certainly why we selected those individuals. So I want to thank you all very, very much for coming out today. Thank you to all of our staff, not only those who are here today, but all staff who've been working so hard during this pandemic. You truly are rock stars. Please know it's appreciated 100%. Please stay safe, please stay healthy, and please, if you're not already so, please get vaccinated. The only way that we're going to move forward and out of this pandemic is if you all please get vaccinated. So I ask that you please do so. Please call the public health line and do that not only for yourselves, but for our patients and for everyone that you love. So thank you very much for coming out today, everyone, and enjoy the rest of your afternoon. Thank you.